Ayurvedic herbal medications, or AHMs, are seeing this huge surge in popularity, and you can see why. Patients often think they're a totally safe, a natural alternative to conventional drugs. But what happens when these natural remedies cause serious, and sometimes even fatal, liver damage? In this explainer, we're going to break down the specific patterns of herb-induced liver injury that every single clinician really needs to recognize.
And this quote, wow, it just gets right to the heart of the problem, doesn't it? There's this dangerous gap between what the public believes and the clinical reality we see every day. A patient assumes, hey, it comes from a plant, it must be harmless. But as clinicians, we know that anything with a biological effect can absolutely have a toxic one. And the liver, which is our body's main filter, is usually the first organ to pay that price.
And that price, well, it can be devastatingly high. Look at this number, 53%. That's the mortality rate for patients who already have cirrhosis and then develop liver injury from an Ayurvedic herbal medication. Let's be clear, we are not talking about a minor little bump in liver enzymes here. This is a life-threatening complication, and recognizing it is absolutely critical.
So to really get a handle on this, let's do a little clinical investigation. We're going to profile some of the most common herbal culprits, and we'll look at the specific patterns of liver injury they cause. We'll even check out the key histological clues that can point you toward a diagnosis of herb-induced liver injury.
First up is ashwagandha. Oh yeah, you've definitely heard of this one. It's incredibly popular. Marketed for just about everything. Stress, fatigue, arthritis, you name it. It's sold right over the counter, and you can bet a lot of your patients might be taking it without ever thinking to mention it to you.
Now, take a look at this. This is the histology, and it's really fascinating. This is a liver biopsy from a patient with ashwagandha-induced liver injury, and what you're looking at is the classic pattern, a severe cholestatic injury. See those dark, dense areas? Those are bile plugs, literally clogging up the liver's plumbing. This visual, this is the smoking gun for this kind of injury.
So, let's sum up the key clinical points for ashwagandha. The pattern is cholestatic, or sometimes mixed. Your patient's going to present with really profound, prolonged jaundice. We're talking it can last for months. Now, the good news is, it's usually self-limiting. It doesn't typically progress to full-on liver failure once the herb is stopped, but man, it causes some significant morbidity along the way.
Okay, let's move on to our next culprit, Gatu kola. You might also see it being used interchangeably with the name Brahmi. This is another really popular one, often sold as a memory booster or a cognition enhancer. Again, it's something a patient might just be taking for general wellness, flying completely under the radar.
And whoa, this slide shows a completely different kind of injury pattern. This biopsy doesn't have that simple bile plugging we saw with ashwagandha. No, instead we're seeing granulomas, these collections of immune cells along with eosinophils. This is screaming an immune-mediated reaction, which is a massive diagnostic clue when you see it.
So the clinical profile for Gatu kola is honestly a bit more concerning. The pattern is a cholestatic granulomatous hepatitis, and it often has features that suggest an autoimmune process. And here's the really crucial difference. Unlike ashwagandha, this injury can progress to chronic liver disease and even cirrhosis, especially if the patient takes it again.
Our third culprit is turmeric. This is arguably one of the most widely used supplements on the entire planet, praised for being this amazing anti-inflammatory and antioxidant. But because it's so common, the potential for liver injury, even though it's rare, is incredibly important to have on your radar. And here's a really fascinating example of its effects. We're not even looking at a liver biopsy here. This is a peripheral blood smear. These bizarre spiky red blood cells are called spur cells, and they showed up in a patient with cirrhosis who started taking turmeric. They went away when the turmeric was stopped and, get this, reappeared on rechallenge. This just highlights that the toxic effects can be systemic and are directly linked to the herb.
Okay, so let's build the clinical picture. The key pattern with turmeric is an autoimmune-like hepatitis. I mean, patients can present with autoantibodies and biopsy findings that are nearly impossible to tell apart from classic autoimmune hepatitis. For a clinician, this is a huge differential diagnosis. Before you put a patient on long-term immunosuppression for what you think is AIH, you have to rule out a turmeric supplement as the trigger.
All right, now we need to talk about a particularly dangerous class of compounds that are found in some of these Ayurvedic herbs, pyrrolizidine alkaloids, or PAs. These don't just cause inflammation. They have this unique mechanism that directly obstructs blood flow out of the liver.
So how does this work? First, the PAs are ingested. The liver, just doing its job, starts to metabolize them, but this process actually creates these highly toxic byproducts. These byproducts then go on the attack,
damaging the delicate endothelial cells that line the liver's tiniest blood vessels, the sinusoids. This leads to obstruction, congestion, and a condition we call hepatic sinusoidal obstruction syndrome, or HSOS.
And this is the result. This before and after histology is just staggering. On the left, you see the initial injury, extensive sinusoidal dilatation. You see all those wide open spaces and some early fibrosis. Now look at the right. Just 1 year later, after the patient kept taking the herb, the liver has progressed to full-blown cirrhosis with bridging fibrosis. It just shows you the rapid and absolutely devastating potential of these PA-containing herbs.
Now, here's a major real-world complication. Patients are almost never taking just one single purified herb. They're usually taking these complex polyherbal formulations, and that presents a huge diagnostic challenge for us as clinicians.
So why is it so difficult? Well, first off, the products are often unlabeled or just flat out mislabeled, so you don't even know what's in them. Second, contamination with heavy metals like arsenic and mercury is a really well-known problem. Third, you've got unknown interactions between the different herbs and between the herbs and a patient's prescription meds. The bottom line is, trying to pinpoint a single culprit is often impossible.
So, given all this complexity, what is our mandate as clinicians? I mean, what are the key actions we need to be taking to protect our patients from this?
It all boils down to this one critical action. In any patient who comes to you with unexplained liver disease, a detailed history of all complementary and alternative medicine use is absolutely non-negotiable. Patients often don't think of these products as medicine, so they won't volunteer the information. You have to ask them, specifically, what supplements, what herbs, or what teas are you taking?
So let's do a quick review of the high-yield takeaways. This table pretty much summarizes the key patterns we've been talking about. For ashwagandha, you're thinking cholestatic injury. For go-to cola, you're on the lookout for granulomas and those autoimmune features. With turmeric, you've got to be aware that it can perfectly mimic classic autoimmune hepatitis. And for those PA-containing herbs, remember their terrifying potential to cause sinusoidal obstruction and a rapid progression to cirrhosis.
So we end with this question. If that natural label really can't be trusted as a guarantee of safety, then what is our role? It's a real challenge. It requires us to be vigilant investigators, non-judgmental communicators, and above all, true patient advocates in a world where medicine comes from both the pharmacy and the garden.